Gurpreet was operated for cancer tongue precisely 2 months back. And you please tell us about yourself and about your experience.
Uh, Actually, I came to Dr. Talwar on, I think, in the second week of the October, and we have gone through a very bad experience just recently. My husband expired because of cancer. So I was very scared, very scared. So I just asked him, "Ki, what type of cancer is it?" But he was so motivating that I came inside and I decided that I will get operated from him. Like my children were not very sure. They were looking around in Bombay, in Delhi. But I just, when I met him for the first time, the way he treated me, he explained to me about my disease. I thought I am going to be here and I will be operated here only. And after that, I think he knows better what it was and how it was operated upon. And but now, after a week, I was comfortable. During 1 week also, the pain I thought it should be or it will be, that was not that, it was not that painful. And every day he used to come and he used to tell me, "You will be relieved tomorrow. You are okay. You are all right. Your all medicines will be just reduced or it will be finished in a day or a two." So it was so motivating. The next day he removed all my bandages. Next day he will come, he will give me something else positive to look forward, so that I should feel that I am going to be normal in a few days. So within like 5-6 days I was discharged from the hospital and I was comfortable. No large quantity of medicines were there, only few medicines is described which I took for 2, 3, 4 days, and I think I took painkillers only for 10 days. After that, no painkillers even. There was little discomfort in eating, but not much. There was no food pipe actually ever given to me, and I could swallow from the very first day, like the liquid, and then after few days, semi-solid. Then I started having my normal food, I think, after 15-20 days. So I could eat well, I could speak properly. That was the God's grace, and because of His perfect hands, I could get into this position. And it is just 2 months now. I could speak well, I could go around, I am eating well, I am leading now a normal life, but I have to be careful, I have to be under observation, and I have to be regularly under his check so that I could go forward with confidence.
You see, Gurpreet, let me kind of share with you the fears which people have, and your fears. I'm putting in words. People think that टंग का कैंसर है, तो मतलब आप टंग निकाल दोगे तो उसके बाद how will I speak, how will I eat? You know, it is not as scary as people think. And then you were a non-smoker, of course, non-tobacco. Rarely it can happen. Rarely. 90% people of the mouth cancer are smokers. They have a tobacco exposure. But there are 10% people who are non-tobacco exposed. Still they can have. Now it all depends upon how early you happen to reach us, or with your intelligence and your faith, you reach the right person at the right time. So in your case, you had reached us in a very early stage 1. It was it was a pretty big looking wound in the tongue, but when we evaluated you, our our evaluation suggested that you were in stage 1. Your PET scans and everything proved that it was stage 1. So we removed the tongue and we reconstructed the tongue from the local tissues, and we removed your nodes from the neck. Nobody can make out, nothing is visible on your face that we gave a entire cut in your neck. And because if you show, there is no cut visible, although there is a huge line here because that line is merged with your regular lines. So cosmetically there is nothing visible on you which can say that you've been operated. And your tongue also, when we see, it looks normal. You can speak normally, you can eat normally. And then the report which came, God is kind that your report came that your cancer is of a good variety. You see, people don't know that every part of the body can have a cancer. In mouth also, there can be a jaw cancer, there can be a tongue cancer, there can be a palatal cancer, various types. So in a tongue cancer also, there are types of tongue cancers which are aggressive, and there are types of tongue cancers which are not so aggressive. Your tongue cancer features, according to the pathology report, are a good variety one. And it was an early stage. So early stage, good variety, you did not even require radiation. Had you come to us late, so that means the stage was high, or had it been a bad type of a cancer, then we would have required radiation also. And sometimes so late people come that we need to give chemo as well as radiation. So to wonder why was I not given, or why is he been given, or that I have taken three things, chemo, radiation and surgery, but somebody has had not. It's all dependent. It's all international protocols, dependent upon protocol, that what stage it is and what type it is, so that what all is required. Surgery is the mainstay of all solid cancers. Surgery is the main operation.
Actually, that is why everybody was so concerned about it, that from whom to get operated.
Yes.
That was very important.
I always say, please choose a surgeon, not a hospital. People have been telling me, I would like to go to New York for surgery. Very well, you're most welcome, but who is going to operate on you in New York?
Yeah.
That's important. Go to PGI, it's a very big hospital, very good hospital. Go to Tata, very good big hospital. Who is going to operate upon you? You choose a surgeon, and then most welcome. You do your homework, choose a surgeon. Because even when I was operating I'm operating for 30 years now, cancer surgeries. When I was operating 20 years back, I could not do such a perfect job. I confess.
So you become efficient when you do it repetitively.
Yes, definitely.
It's not that from the day one you can be so perfect, so efficient.
There used to be time 20 years back, same kind of surgery, because your tongue cancer was lying posteriorly, quite behind. I used to open the jaw, not only the lip. I used to open the mandible. It's called a mandibulotomy, to reach that space, because it was so much behind. So, but with experience, maturity, one knows how to do the optimal job with minimal morbidity and complete removal. The two things, after all, in a cancer surgery. One is that it should completely be removed, and second is that it should do minimal damage to you.
So when I went to Tata after this, so even the doctor was little surprised, because they were again testing my all the slides and everything. They were little skeptical, because they thought the number of nodes.
The MRI was suggesting it too big.
Yeah.
MRI was suggesting as if it is a T4 tumor. But then MRIs and all PET scans and everything is secondary. Primary is our clinical assessment. So my clinical assessment was that it's a small tumor. MRI somehow, or not always that they are correct. It is 90% they are correct. PET scans also 90% they are correct, but not always. Because after all, the tumor is lying against your cheek. So the MRI thinks that the cheek is also involved. Whereas when I separate the cheek from the tongue, it is not involved.
They said
they also got nodes. Yeah, we only removed these many nodes.
Yeah.
We did not go into the entire neck. We just removed these nodes. We call what is called a selective neck dissection. We did not do a radical neck dissection, because the PET scan had showed that the nodes are not involved. So we do a targeted neck dissection, so that we get the answer also, and we don't do you any damage. And in 2 months' time, you look absolutely back in shape. And you've been a principal in a college, and I thought this is the best occasion that we can take privilege of, communicate with each other, and talk about certain facets which can help everybody. People have these questions, you know. So thank you so very much.
Thank you.
I know, thank you, my
for
dear.
the,
Thank you.
Thank
all
you.
the help and
Thank you.
the comfort you provided. It's the most important, because the patient is very much afraid of all the environmental things and the knowledge he has.
And I
So-
was sharing with people, you know, even I as a doctor, young doctor, didn't know what is a 5-year survival. When we talk about 5-year survival cancers, and you gave me the answer, I'm so very happy. That 5-year survival means that for 5 years you would be under observation. After 5 years, you are free of cancer. Now, 5-year survival doesn't mean that you can live only for 5 years. People think it that way. 5-year survival in cancer means that after 5 years you are declared cured. So we said that we'll review you every month for 3 months, and then every 3 months for 2 years, and then every 6 months for the next 3 years, and then declare that you were fit. My patients are doing well. I mean, early patients have been in 90s. They're doing well till now. One of my younger colleagues in the team was having a cancer tongue. And now he's principal of some medical college. I operated upon him 12, 14 years back. So don't you worry, you are going to be alright.
Thank you so very much.